Every year, well over 70 million people visit their doctor's office, but sadly, many people avoid regular colon screenings and don't seek medical attention for common digestive symptoms. Gastroenterology Consultants is a division of Heartland Clinic with a dedicated group of physicians working in concert to provide the highest quality care in an efficient and friendly manner.
Gastroenterology Consultants was founded 34 years ago by my father, Dr. Raumova. He's been providing high-quality gastroenterology care that we continue to this day. Some of the most common issues we deal with on a daily basis are colorectal cancer screening, abdominal pain, irritable bowel syndrome, diarrhea, constipation, and heartburn.
This facility is not only using the most advanced technology available today, but also has specialists in both adult and pediatric gastroenterology, anesthesia, pathology, nutrition, and interventional pain management to meet the needs of patients. With a better knowledge of causes and prevention as well as new approaches to care, digestive diseases are more treatable and preventable than ever. In fact, when cancer is discovered during a routine screening, patients have a 90% survival rate.
Colon cancer can affect anyone. It's one of the most common cancers in both men and women in the United States, but it's very preventable with a colonoscopy, removing polyps before they become cancerous.
A cancer cell is usually present 10 to 15 years before it rears its ugly head. So the longer you wait, the more it grows. The more it grows, the more it invades. The more it invades, the less likely you are to have a good outcome.
Patients can definitely have an impact on preventing colon cancer. The biggest way is showing up to their doctor's office for their screenings. If they can work with us on getting their screenings and making sure that they take the prep adequately, we can most times prevent all of these colorectal cancers.
You need to know the prevalence. There's over 100,000 new cases of colon cancer per year. There's 40,000 cases of rectal cancer. All of these cases would be found on screening and are treatable if caught early enough.
Mary Wassell can attest to the important role screenings play in prevention and early detection of colon cancer.
I went for my well exam with my primary care physician. Other than being very fatigued and feeling very tired, I thought I was doing well. But when he looked at my lab work and saw that my hemoglobin was low, my blood volume was low, he was quite concerned. And I thought I knew why those things were low, but he recommended that I have a colonoscopy.
The best thing about a colonoscopy is that if we see a polyp, we remove it right then and there. Sometimes we can even remove small cancers at the time of the colonoscopy, which is the best for the patient because they get to wake up and it's already in the jar.
But in Mary's case, the polyp that was removed turned out to be malignant.
The tumor was invaded into the third layer of the colon. They couldn't be for sure that it had not invaded the colon. Had I waited until I was 50, I probably would not have seen 50.
Mary was fortunate. At least 6 out of every 10 deaths from colorectal cancer could have been prevented by routine screenings. Early detection is still the best chance for a cure.
A primary risk factor is if you or a family member have had previous precancerous colon polyps and or colon cancer. People who have colon cancer can get colon cancer again.
Since that time, I've had routine scopes when they tell me to. I have never missed a one. I will never miss a one. It's not a difficult procedure. It's easy, and it's worth it because if I had not done this, I wouldn't be here today, and I know that for fact.
Average risk people should start getting screened with a colonoscopy at age 50. Those with higher risk factors such as smoking, having a family member with colorectal cancer, or African American heritage sometimes need to start getting screened earlier.
That was part of that bravado with me in that because I wasn't feeling anything, didn't see anything, and no pain, that I thought things were okay, and what's the sense of going to the doctor if you don't feel or see anything? And that was my case, and I'm sure that's the case with a lot of African American men, is just the fear of the unknown, but you can get that false sense of security by not knowing or not feeling anything. And I'm a perfect case of being stubborn for almost 15 years and then finding myself in a position that I never wanted to be in, but happy that it was recognized and taken care of.
I had a friend who he was turning 50, and I said, I know you're going to be 50 in July. You need to get your test scheduled. I kept on him and on him. He says, leave me alone. I said, no, I am living proof that you will be alive if you have an issue, if you get screened. He went, he did have a malignancy, and he was cured without having surgery with just the colonoscopy.
This whole process has made me more aware and conscientious of my health and taking better care of myself.
One of the biggest risks of waiting on your colonoscopies beyond the recommended times is of developing colon cancer or developing later stage colon cancer. This can be highly lethal or require much more intensive therapy, including chemotherapies, larger surgeries, and sometimes radiation.
This whole process has made me more aware and conscientious of my health and taking better care of myself.
There should never be someone who dies from colon cancer. If you catch it early, it's treatable either by surgery or treatment, and no one should ever lose a loved one to colon cancer.
There's no symptoms of colon cancer. Most people who are found to have a colon cancer are found during a routine screening. It's very important that we find these early. The added benefit is that when we do these normal colonoscopies, we're removing the polyps and preventing colon cancer altogether. That way you never have to worry about it.
My last scope was a year ago. It was clean, and I recently celebrated 10 years cancer-free.
Improving outcomes, quality care, increased efficiencies. Focused on patients. It's that complex, it's that simple. It's who we are at Gastroenterology Consultants, a family of healing partners.